Hello, Happy New Year. Welcome 2022, and welcome to day 7 of the 12 days of articles in review. Just to recap where we've been, since December 26th, day 1, we looked at the longer term outcomes, right? We talked about the Crump paper and how they really did a nice job illustrating the lifelong morbidity and mortality associated with being born prematurely. We talked about the implications of this on families. We looked at the clinical report from the American Academy of Pediatrics. Yesterday, we looked at the Frank et al. Paper, exploring and trying to understand what are the attitudes that clinicians have about family-centered care, and how can we overcome them, particularly now in the swell of the COVID response and how that's added additional trauma and burden to the families. We looked at the Cooper paper, and where she was able to demonstrate that clinicians who embrace a trauma-informed approach to care in the service to micropreemies and their parents were actually able to create much more favorable nurse-parent relationships as depicted by the parents as a consequence of their approach to trauma-informed care. So today's paper, I'm going to share with you the policy statement from the American Academy of Pediatrics. It was published in the same issue as the clinical report that I presented a couple of days ago. The lead author on this is Dr. Duffee. The secondary author is the incoming president to the American Academy of Pediatrics, Dr. Szilagyi, and Dr. Szilagyi's, oh, good golly, I just had a brain fart. Focus for her term as president of the Academy is focusing on trauma-informed care and mental health within pediatrics. And so this is a real timely paper. And what I'm going to do is I made some highlights of some key areas in the paper that I'm just going to share with you. This is an open source paper, and I just realized that I did not put the information into the chat bar. I'm going to do that right now. 2021, and it's called Trauma-Informed Care. Let me just double check here. Bear with me. In Child Health Systems. Okay. In child health systems, and I'll try and the journal is Pediatrics, as I'm sure you can imagine, and I'll try and find the DOI before we break from this session. Okay, so actually I'm going to do it now because I will probably forget and jump off. So just hang in there with me for a moment, and here we are. I'll just put the URL. And then you can just kind of go right direct to the paper, okay? There you go. So there's your URL over there in the chat box. Grab that paper. It's absolutely paramount, particularly if you work within pediatrics, to be abreast of this summarization and recommendations, and even recommendations, not just for clinicians, but for policymakers, for healthcare professionals, for insurers, for anyone who has any kind of interaction with the pediatric patient population. So they start out, and I highlight this kind of summary of what trauma-informed care is, that trauma-informed care and child healthcare organizations operationalizes the biological relevance and evidence of toxic stress with the insights and understanding about the importance of attachment and resilience to enhanced healthcare delivery and mitigate the effects of trauma. They go on to say that the resulting pediatric healthcare delivery strategy will then promote and restore resilience in children, adolescents, partners with families to support relational health and reduce secondary trauma among pediatric healthcare clinicians. And if you'll remember when we touched upon the clinical report and even in the Cooper paper, you start hearing the same concepts emerge in the literature, talking about the importance of relational engagement, relational health, that the relational health really is the turnkey that can either make or break a trauma experience, that can either promote that ongoing feeling of fear, terror, and isolation versus promoting and cultivating resilience in the individuals. So they summarize that over the past 20 years, basic science has explained how cumulative adverse experiences in the relative absence of safe, stable, and nurturing relationships alter our biology. And they go on to delineate all of the different systems that are involved. And I think you've probably heard a lot of that. And the Academy feels very strongly that this trauma-informed care approach offers an organizing principle. And it pivots off of their original work back in that 2012 paper, talking about actually introducing the eco-biodevelopmental framework that is the cornerstone for the science of pediatric medicine. So trauma-informed care offers an organizing principle for pediatric practice that improves awareness of the spectrum of trauma-related symptoms, promotes an emotionally safe environment of care, and provides specific interventions to mitigate the effects of trauma exposure. And that just triggered a thought about the paper by Isabel, was it? I forget her last name now. Or I could have the name backwards, but the paper written by the nurse researcher who is in mental health. She's a psychiatric nurse researcher, and she talked about the challenges of the trauma-informed care paradigm within behavioral health, and that there was, because of what was interpreted as kind of loose or indiscreet definitions of what constituted trauma, that there was some resistance about that. But I like how the Academy really kind of embraces that broad spectrum and recognizes that the trauma experience is not the same across all individuals, right? Across all patient populations. So they go on again to give the background. They again reference the National Child Traumatic Stress Network, which is a great resource, and they do have really cool resources for pediatric clinicians in critical care settings. They talk about the relational health, how it cultivates resilience, and then they also talk about the exposure to trauma as being pretty common. And I believe this was the paper that let me just scroll down. Delineated the different types of trauma and the urge towards kind of those leaders in behavioral health and other healthcare disciplines, the need for child-specific trauma nosology, so language that's really going to help us be able to identify the different kinds of trauma that present themselves in people's lives and present themselves in clinical environments. And so what the Academy has done is they've kind of delineated some discrete domains where trauma can present itself, and they identify developmental trauma disorder, they identify pediatric medical traumatic stress, and then STS, or secondary traumatic stress, and that's often observed in families and also clinicians, that secondary traumatic stress. So the diagnosis, the developmental trauma disorder is really about looking at that kind of that post-traumatic stress constellation, right? That complex trauma history that manifests itself in derailed development. They talk about the pediatric medical traumatic stress. And of course, I was super interested in the data that they shared in this description, that it's incredibly under-recognized and rarely addressed despite its high prevalence. And we all know that, right? You work in the NICU, you work in the PICU, you work in the cardiac care unit, you work in healthcare. And most often, folks are not acknowledging the presence of pediatric medical traumatic stress. And that one of the references gives some stats about it, that up to 80% of ill or injured children and their families may have traumatic stress reactions after a life-threatening illness, injury, or procedure. And in some surveys, up to 20% of parents of children admitted to a PICU developed PTSD within a few months. And we know that there's similar data within the neonatology area as well. There was one study found that approximately 10% of children following pediatric intensive care, not just PICU, just any kind of pediatric intensive care, 10% of children developed signs and symptoms of PTSD 3 to 5 months after a major surgery, and 28% developed symptoms consistent with post-traumatic stress syndromes that resulted in functional disability by parent report. So we know that this is pervasive. We know that there's a constellation of symptoms, and we need to be cautious about how we screen for this, how we recognize this, and then activate the appropriate care plans to address these traumatic stress responses and traumatic stress experiences. So the policy statement then goes in to identify core elements of trauma-informed systems. They include safe physical and emotional environments, and I love that they included that there. They talk about patient and family empowerment, leadership commitment to trauma-informed care. It's not enough for frontline clinicians to enroll and become trauma-informed professionals or attend these conferences talking about trauma-informed care. If you're going to transform the existing paradigm, right, to shift from what's wrong with you to what happened to you and really embrace that and honor that, you need leadership commitment and investment in that. Another key component is that the trauma-informed paradigm is continuous throughout the healthcare system. So it's not just in certain units, it's how the entire organization shows up for the patients. It's being mindful of recruiting and training the workforce to be familiar with trauma-informed care, to be able to recognize how to cultivate those ways of being in engagement or in relationship with the patients. And I know I've said this along throughout the series, that trauma-informed care isn't about doing more, it's about being more, showing up more authentically, more vulnerably, more compassionately. Another component of trauma-informed organizations is coordinating the care across family-serving systems in the community. And this has been a challenge for eons, right? I mean, making that connection from the inpatient experience to the outpatient experience, those gaps in care where people literally fall through the cracks and they're lost to follow up. So really building and hardwiring those systems that are multidisciplinary. We're not just looking at hooking them up with the specialty services that meets their disease or their surgical or their medical needs, but it's their whole human needs. And so then the paper summarizes with recommendations for system level implementation. And this was very, very thoughtful how they pulled this together. So they talk about federal and state funding. So they're really, I mean, the Academy is really identifying how we transform is at every single layer. It's at the front line, and it's at the C-suite, and it's at the government level. So that federal and state funding level, where we're really going to make those investments and address and recognize that the trauma is, yes, there's medical trauma, but if you think of healthcare, we're simply a microcosm of society at large. So there are other elements of trauma, right? There's gender inequity, there's racism, there's classism, there's all of these other, just all of sexism, all of these other forms of trauma that we need to be aware of in our systems of care. So they identify all of these different levels. They talk about large health systems, insurers, and managed care organizations as another level, and then academic centers and children's hospitals. So they've really kind of come down and been very thoughtful to help you begin that journey to transformation, all right? And then for each of those subcategories, they've delineated specific actions. So specific actions at the federal and state government level, for the large healthcare systems and managed care organizations. And then for the American Academy of Pediatrics, chapters and academic institutions, how we educate folks. And this is something that we've worked on here at Caring Essentials, with the Trauma-Informed Professional Certificate Program. Yes, right now we're really focusing on those frontline clinicians, the legacy professionals that are already in there doing the work, interfacing with these folks in crisis. But we also need to integrate this awareness, the science, the soul behind it in the curriculum for healthcare professionals across all disciplines, so that we kind of meet in the middle then, and we're covering all of the bases. So I really like how they've done this. It's a brilliant paper with very tangible strategies to begin the transformation of healthcare to a trauma-informed paradigm. I absolutely recommend this paper. And so for the next the last few days of the 12 days of articles in review, the next 5 days, I'm really going to be kind of highlighting some of those strategies and where we can make those small steps, but those necessary next steps to begin to transform the heart and soul of healthcare around the world for babies and families in crisis and for ourselves as well. So I want to thank you very much for tuning in. This is really great. Happy New Year. Wishing you a very powerful, peaceful, and prosperous 2022. And I'll see you tomorrow at the same time. Toodaloo.